fully vaccinated people can visit with other fully vaccinated people indoors without wearing a mask or physical distancing. Visit with unvaccinated people from a single household who are at low risk of severe COVID-19 disease indoors without wearing masks or physical distancing. And refrain from quarantine and testing following a known COVID-19 exposure if the vaccinated person remains asymptomatic.
All right, let's bring in NBC News senior medical correspondent Dr. John Torres. Dr. John, one of the highlights of this new guidance, this is terrific, fully vaccinated grandparents can now visit with their grandkids, even if those kids aren't vaccinated. That's pretty cool. What else is the CDC giving the okay to today?
And you're right, Allison, that is probably the best news out of what they talked about today. And the main reason I'm saying that is because since the beginning of the pandemic, that's probably the #1 question I have gotten, especially from grandparents. When can I see my grandkids? When can I hug my grandkids? When can I sit them on my lap and read them a book? The answer they gave today is if you're fully vaccinated, you can do that now. So they basically went through a few steps here. #1, they said you need to be fully vaccinated. That means that you have to have all the vaccines, 2 for Pfizer and Moderna, 1 for Johnson & Johnson. Wait those 2 weeks, then you're fully vaccinated. If you're fully vaccinated, you can get together with others that are fully vaccinated indoors, don't need to wear masks, don't need to social distance, still need to be small groups though. But then they went one step further. They said, if you're fully vaccinated, you can get together with unvaccinated people from a single household. In other words, family members for the most part, and you don't have to wear masks, you don't have to social distance, as long as they're at the low risk of suffering COVID complications if they do get sick, because you remember, you're protecting them from getting sick because you already have the vaccine. And the other thing they said is if you're fully vaccinated and you get exposed to COVID, you don't have to quarantine or test unless you start developing symptoms. These are 3 huge steps, Allison, especially, like you said, that grandparents one, being able to get together with grandkids. If there's no other reason to get vaccinated, this is the best one.
Yeah, that is pretty cool. All right, so Dr. John, let's get into some of the don'ts. What is the CDC warning fully vaccinated people not to do? And what sort of COVID safety precautions should fully vaccinated people still be taking?
And the other thing to remember is even though you're vaccinated, we still don't quite know the transmission rate. In other words, if you're able to transmit the virus to somebody else, even though you don't get sick from it because the vaccine is protecting you. So what they want you to do is when you're out and about, just like you do right now, wear a mask, social distance, the 4 W's we talk about, wash your hands, ventilate, go out in small groups, don't go with large groups, and then avoid unnecessary travel. They brought all those points up. The main point being, again, we need to get to that herd immunity level. We're not even close to being there right now. So they said until we get to there, they're not going to be able to add more steps, but they think they're going to be adding more steps fairly soon, Allison.
Yeah, so let's talk about that a bit more, Dr. John. Dr. Walensky said several times during today's briefing that these are guidelines for private settings. The CDC is not updating guidance on travel or for public settings. We still have pretty high levels of the virus all over the U.S. So how many more people need to be fully vaccinated? What stage do we need to be at for these guidelines to change in a more significant way?
And you're right, Allison. She brought up a lot of points. And one was that we're still at that 60,000+ level every day here in the United States. We talked about last summer how we were down to 20,000, want to be down to 10,000 or less. We're not even close to being there yet. On top of that, adults in the U.S., 9.2% are fully vaccinated. That's far less than the 70 to 85% we need for herd immunity. Once we start getting closer to that, you're going to see more things open up. These are essentially baby steps that the CDC is taking, saying, hey, there's a great reason to get vaccinated besides protecting yourself and your community. You can now start to do things. And the more people that get vaccinated, the more things you're going to be able to do, Allison.
All great news. I know for some people it may seem like baby steps, but they're baby steps in the right direction. Dr. John, I understand there's a case of the Brazil P1 variant in Ohio, according to the Cincinnati Enquirer. What do we know about this strain and its presence in the U.S.?
So the P1 strain, Allison, is the one that's out of Brazil, was first noticed there. It's similar to the South African strain, that B1351 strain that's down there. We do know it's more contagious, meaning I can catch it and spread it more. We think it might be more dangerous as well and able to get around the vaccine a little bit better, although the vaccine more than likely is giving us some protection against it. But the concern is, since we're seeing that case and we've seen other cases sporadically throughout different states, that this is already hitting the community spread level. In other words, it's not not people that have traveled. It's people that have got it inside their community. And that's where it gets concerning. And that's why they're doing all the surveillance right now and really ramping that up so they can get a good hold on it. Because if we can get a good hold on it, then we can make sure that those people are isolated in quarantine and it doesn't spread as much. Again, getting vaccinated is certainly going to help these variants get under control, but also testing is going to help that as well, Allison.
All right, and we are ending this one on a high note today, Dr. John. Fully vaccinated grandparents can see their grandkids. That's terrific news.
That's fantastic news. And like I said, that's the number one question I've gotten all year is when can I see my grandkids? If you're fully vaccinated, you can see them tonight.
Oh, that's awesome. Dr. John, thank you so much.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.